Hi, this is Dr. Sujata Nair from Anatta University. We are a facility that treats addiction to alcohol, substances, and prescription medication. We treat single clients at our luxurious facilities close to nature with an exclusive alternate life therapy program, wherein our therapists, counselors, doctors travel with our client and live with them, being available to them 24 by 7. Now, in our experience of 16 plus years, we have seen that a lot of relapses that happen in the field of addiction have a sexual connotation. And sex and sexuality is a very least understood subject in society and least spoken about subject in society also. With this in view, we decided that today's webinar we should bring in an expert on board, Dr. Colonel Rajeev Sood, who is a postgraduate in urology. He is HOD and head of department and heads the andrology, the urology, robotics, and renal transplantation department of Fortis Hospital, Vasant New Delhi. Dr. Sood, since I've just elaborated that there's a lot of anxiety associated with sexual function in addiction, post and pre, so there's a lot of confusion around it. Could you please elaborate on the same?
Good morning, Sujata and everybody else. Thank you for having me on your show. I would like to share with the viewers that we don't live alone, so most of our problems, if we have our partner alongside, it makes life easier. So I hope that most of you are watching this show in tandem with a partner. Talking about anxiety, sadly, the current times are such that there are a lot of factors, from financial, from disease-related issues, grief, overall health status, that we are going through a lot of anxiety. Addiction, when we resort to an addicting substance to ease that anxiety, it spirals into a lot of other problems, and sexual problems, of course, being one of them. When everything is not going right, since sex is a pleasurable activity, we try to indulge in sex in the hope that it will take away all the other troubles. But again, both these things happen together, and so you cannot address a sexual or a sexuality issue in isolation. It has to be addressed in terms of how the person, his companion, and how society look at the overall problem. So we will try to address sexuality and sexual issues as we go along.
So, doctor, since we are on the topic of sexuality, there's a lot of, before we elaborate it where addiction is concerned, there is a lot of confusion about what is even normal sexuality. So, vis-a-vis what is abnormal. So it would be great if you would elaborate.
Sure, surely. So if I go back in time to when I was in medical school, that was many moons ago, sexuality was understood as a man-woman relationship, as a heterosexual relationship, and a lot of other relationships like homosexual equations were labeled as perversions in our textbook of forensic medicine. Mercifully, over time, society has changed, perceptions have changed. So, till I get to this point, perversion slowly changed into what society would label as deviant behavior from an individual. But today, thankfully, we talk of sexuality as a sexual preference and not as a perversion or a deviant behavior. Now, if I were to say that the list of sexual types, if I were to enumerate them, it could be very confusing, from allosexual, demisexual, asexual, gay, lesbian, LGBT, queer, questioning. But without going into the specifics of sexuality, suffice to say that society has changed sufficiently to accept that whatever be an individual's leaning, doesn't condemn him to being guilty of something. Yes, a person who got married, thereafter discovered that his leanings were different from a conventional straight heterosexual relationship, that generates a lot of conflict, that can generate a lot of grief in the partner, and a person may carry guilt based on what he thinks how society is judging him. So I would like to reassure the audience or the people who are going through similar distress that do not consider yourself guilty of anything. You need to feel comfortable that what you are feeling and perceiving deep within is real. Needless to say that just as we change over time, our thoughts change over time, our preferences change over time, and our sexuality may also change over time. Doesn't mean that any of what I've said is engraved in stone, but you need to feel comfortable and try to eliminate conflict from your mind. The audio has gone for some reason.
Accidentally. I would repeat that. Is that what
Yes,
we have seen? Yes. That what we have seen is that when you're talking about change that is happening over time with respect to age, with respect to social circumstances, etc., and people need to be comfortable with themselves, the idea of what is a normal sexual response cycle is also needs to be, uh, you know, taught or needs to be shared with people in general, because these are topics which are not spoken about very openly in society or
sure.
even in families.
So I shall share my thoughts in two slots. The focus on sex is very important because sex as an act brings lot of benefits to the mind, to the psyche, and to the body. I'm sure most people would be aware that sex is a kind of exercise. So it improves your stamina, it eases the stress levels that you may be going through, you get a good night's sleep. We are familiar with the word that your face is glowing, implying that somebody's had sex. But yes, sex improves blood flow to the skin, and you do actually literally glow also in more ways than one. Heart attacks go down if you are having regular sex and if you're fit. So needless to say that the time and effort that you are spending to make people aware is something which comes with a lot of benefits. The sexual cycle, we may try to limit it to the four phases that we are familiar with in the form of desire as phase one, followed by arousal as phase two, a third phase called plateau, which is actually not plateau, but a multiplier of arousal leading to a point of orgasm. Orgasm may be the shortest phase, but oftentimes is a very important phase, if not the most important phase, because those who don't get to enjoy an orgasm in the act often feel incomplete. And lastly is the resolution phase, when you are relaxed, and that's when you're happy, you're sleepy. But resolution is also a very important phase because it helps the two people, the two partners, to bond and make the act, which is an intimate act, continue to contribute. Now, without merely addressing the sexual cycle, a very important part is anticipation. So, do not think that anticipation is merely planning for pleasure of the sexual cycle. but anticipation in itself is pleasurable. So partners need to communicate, need to plan, because that itself is a pleasurable activity leading on to whatever else may follow as the sexual cycle. Sujata, you may like to add where something which is otherwise normal, people start indulging in addictions to then try to enhance the various aspects of the sexual cycle.
Yes, doctor. See, what we have seen is that various substances which people start using or get addicted to eventually initially begin as a lot of fun and experimentation. Like any substance, whether it's alcohol, cocaine, crystal meth, or mephedrone, all of these increase your sexual desire, reduce your inhibitions in indulging in the act, which can then result in multiple sexual encounters, sexual partners, and even the feeling that the sexual act itself is prolonged because of the use of these substances. Now, when any substance reaches the addictive stage, what actually happens is that the desire is high, but the ability to perform the sexual act is diminished. And hence it gets prolonged. The orgasm is delayed, but that is viewed as being pleasurable vis-a-vis when the person comes into recovery, meaning when the person stops using the substance after going through treatment. That person's experience of sex then is very different, as in that the duration is shorter, their the pleasure is there, but the duration of the act is definitely shorter. Orgasm is reached or ejaculation is reached faster. Hence, there's a lot of, again, anxiety created that is this normal? Am I having premature ejaculation? Am I getting impotent? Where, from a male's perspective and from a woman's perspective also, is something wrong with me? Am I getting frigid? Do I need help? And there is nobody to talk to or elaborate or converse on this, whereas we at Anatta do address this at length. However, as the expert in the field, Dr. Sood, I would like you to elaborate on how these substances affect sex and sexuality, and how male and female sexuality differences also happen in those who are using substances. Dr. Sood.
Thank you. Thank you. Now, as much as I talked about the sexual response cycle, but for this cycle to play out, you need a brain that is receptive and active. You need a nervous system which perceives touch, smell, sound as the inputs to get the brain activated. You need a vascular system which is pumping blood into the genital organs in a preferential fashion to bring about changes in the man, which involve more blood flow into the penis and leading to an erection. In a woman, they involve more blood flow to the genital area with more secretions from the cervix, from the vaginal lining, from the glands in the vagina, leading to lubrication, which would then facilitate intercourse. So once we understand the sexual cycle and we also understand the anatomical parts required to successfully conclude that cycle, and we bring in intoxicants to tinker with our perception or our performance, it may seem that the intoxicant initially works on some phases of the sexual response cycle. So as you rightly brought out, that alcohol, cocaine, cannabis provoketh the desire. So somebody who is having a low desire may think that if I consume some of these things, it would enhance my desires. Actually, more often than not, the so-called enhancement that it brings about is more to do with easing anxiety, easing the guilt and taking away the inhibitions which we may have acquired in our adolescent years or in our growing up years from our past sexual experiences. So in the short term, It is just a perception for the person involved that I am feeling good or I am feeling better. But when it comes to the actual body parts and their performance, all these intoxicants have a negative impact on the sexual cycle. So if your mind is not perceiving a sensation, if you are so drunk that you are incoherent, communication is suffering, alcohol makes the blood pressure fall, so there is less blood flow to the genital organs, so there is a poorer erection. So not for a moment can science recommend any of these intoxicating substances as sexually uh, performance enhancing substances. Sadly speaking, consequent to whatever may be social perceptions or peer pressure, leads a person to experiment with these substances, and then some people unfortunately become addicts, and then it all spirals downwards, where relationships suffer, where a lot of distress happens. And that's where people like you, who help such patients come out of their troubles, play a very important role in fixing problems generated by intoxication and addictions.
Yes, doctor. Where we come in is where the counseling aspect is, because we have seen that a lot of our clients have a background or an experience of childhood sexual abuse or even dysfunctional families around them. Once the substance abuse is started initially as an experimentation, it becomes an addiction and a solution for their emotional issues. See, in addiction, the core issue is always an emotional issue or an inability or a difficulty in dealing with one's emotions. That also adds up to the sexual aspect of it, wherein one's rapport is built with the client, and the client, whether it's a male or a female, becomes comfortable to converse and to share about their sexual aspects and sexual activities and their experiences. Because, as you rightly said and as you elaborated, the inhibitions drop. When the inhibitions drop, what happens is that there is a lot of indulgence in sexual activities, which, when the person looks at it in retrospect after they sober up, they feel and experience a lot of guilt and shame associated with the same. Now, this guilt and shame can be self inflicted, or it can be brought on by family around them or society around them also. So, that emotional unmanageability is what we help the person to deal with through counseling techniques, through assuming responsibility by writing about or journaling these experiences, and also, most importantly, with the help of meditative techniques, which help them to deal with a lot of their suppressed and repressed emotions, which can surface and which can be shared in a very safe space that is provided to them with people who have already experienced what they might be experienced at that point of time and have dealt with their own issues. So the experiential counselors around them also act as motivation factors or points in helping them to get beyond the guilt and shame around the sexuality, sex and sexuality, or their sexual experiences that they go through. And if there is any pathology involved, then we definitely approach experts like you and we encourage them to seek help. See, this is a topic which is rarely spoken about and rarely addressed, even in treatment facilities, unfortunately. We are probably the only facility that addresses it at length, not only with the person who is addicted to the substance, but also with the family, because the family or the spouse is an integral part of that person's life. And sexual function, sexual desire, sexuality, the act of sex, and the sexual relationship is a very important part of any kind of relating with one's partner or spouse. Which you rightly said in some of your earlier questions, communication is a key factor. And we encourage the family to enhance their communicative skills with each other, not only related to addiction and emotions, but also where their sexual desires and sexual experiences are concerned. So,
I
doctor, when
couldn't,
yes,
yeah, I
yes,
couldn't
doctor,
agree
please.
more with what you have said, because as much as the problem is medical or the problem is a performance related issue, there are significant contributors of the psyche as much as there is contribution from organic issues or medical or anatomical issues. It's easier possibly to fix issues of the body. It's tougher to fix issues of the mind. So the first thing that you as much as you as a counselor and I as a doctor try to tell our patients that there is nothing right, there is nothing wrong. You are unique in your own self, your expectations and requirements. You are entitled to your expectations and requirements just as much as your partner is entitled to his or her expectations and requirements. Doesn't make either of you right or wrong or good or bad. Now, patients who come to me alone, I always ask them to bring their partner. Patients who come with their partner, I find it easier to address their problems because it implies that they inherently have a good communication between the two partners. So it makes my job easier of trying to wipe the slates clean and then getting them to connect or reconnect. Now, there is no denying the fact that opposites attract. So initially, what we like about the opposite sex or our partner is something that we may be lacking. But once we bridge the gap or become a pair, we suddenly find that now the opposites become a source of conflict. So if the woman wants conversation, hand holding in the preliminary foreplay stage and wants a conversation in the resolution stage, suddenly the man feels differently, that it all has to be about the act and the orgasm. So we need to accept that men, yes, they need every sexual encounter to end with an ejaculation, but that inherently makes them the weaker sex. The woman can indulge in sex, have or not have an orgasm. If she has an orgasm, she may have more than one orgasm. So technically her pleasure is indefinite. So she is actually, when it comes to sexual performance, the stronger of the two sexes and possibly less challenged in terms of the act. Now, satisfaction, one way of achieving greater satisfaction is by reducing your focus on your desires and instead focusing on your partner's pleasures. It helps in two ways. One, it reduces your own anxiety. Am I having an erection? Am I not having an erection? That is a worrisome thought. If you instead focus on your partner's pleasures, whether it is just a touch or a caress or a massage or oral sex or whatever, suddenly you find that you are more engaged in the act because the focus in your head has shifted from yourself and moved to your partner. Other than the partner feeling good that you care about his or her needs in the act. So both people need to communicate. Both people need to understand that there is nothing right or wrong. Fantasy is a fantasy. It is not reality. We need to accept that fantasy has a very powerful role to play in sexual intimacy. If a partner chooses to share his or her fantasy with you, you need to respect the fact that he or she felt close enough and comfortable enough to share his or her fantasy with you. So you are actually being honored if your partner is sharing their fantasies with you. It is not that your partner wants to sleep with somebody else or is attracted to somebody else. Yes, at a superficial level, that attraction may have generated the fantasy, the attraction to the act or the person. But the fact of the matter is that your partner is choosing to share that fantasy with you. reality within that fantasy may not be half as pleasant as the fantasy in itself. So I feel communication is the key. I feel fantasy sharing is another very important part of trusting your partner, being comfortable with your partner to then get started on the journey, which obviously is pleasurable and beautiful, other than saying that biologically it is required to keep the species going. Sujata, your thoughts?
Yes, doctor. I feel what you have just shared would have been enlightening to so many couples out there, wherein a lot of conflicts would have arisen just because of this fantasy sharing or lack of the fantasy sharing. Because there's should I share or should I not share is the first thought that comes to any person's individual partner's mind. How will the other person perceive it? And more often than not, it is not perceived in the right, healthy manner as you have advised it to be perceived. This has definitely, I'm sure, thrown a lot of myths and mistrust issues out of the window, what you just shared. That is one aspect. So, doctor, as you also said, communication is the key, which also in our clients who suffer from addiction, once they have completed their treatment process and they go back home, communicating their sexual desires and their sexual needs with their partner, and also having the support of the partner when the act is not apt or not appropriate or not satisfying enough. And what you just shared about sharing and about communicating things correctly, or focusing on the other person and enhancing and trying to see that the other person receives pleasure, reduces in turn one's own anxiety of performance, and hence one's own performance gets resolved. So that's a great thing, doctor. And how would you come across, like, if there are a lot of questions that a lot of men have, the doubts that, as we spoke about, premature ejaculation, and when one consumes alcohol or other substances, there's an increased urge, but the performance is affected. So would you, and that can be perceived or it can be real. So could you elaborate on that?
So, Sujata, I would gladly answer your question, but as we were talking, there was one more facet which I want to address before we get down to the mechanics and fixing the mechanics of the human body,
Okay.
which is very intimately linked with substance abuse and if you want to use alcohol specifically because it's easily available, some of the other
Hmm.
substances may not be easily available.
Hmm.
Men and women have always had this conflict around monogamous relationships and polygamous relationships. Now,
Yes.
if we are talking about personal satisfaction, well, that is what you want your body to receive and perceive. That is personal satisfaction. What you want to give to your partner, it's like saying that you care for your family and near and dear ones differently than what you care for society at large, for colleagues.
Hmm.
So
Hmm.
you cannot equate caring for a partner in the same breath as having sex with an individual. So after your own gratification, you obviously want to care for your partner. Now, on the one hand, fantasy driven polygamous relationships versus guilt consequent to multiple sexual relationships, consequent to your partner feeling hurt and let down if he or she discovers that you've been in another relationship. Now, here, I would like to share with my audience that you can work on your brain to handle situations. The brain is a wonderful organ, and strangely, it learns to cope with any kind of insult and any kind of stress. So please don't hold on to a hurt or a guilt so tenaciously that it starts harming you, and then you resort to compensations which go into a negative spiral. So compensations could be alcohol, compensations could be breaking up relationships, compensations could be avoiding the sexual activity, which in itself is something very intimate, which bonds people. So do not let hurt negate something which is wonderful. And what is definitely the case, and I've had some women who have got to know that their husbands have had more than one relationship and are very upset. And I've also had women who've come and said that doesn't matter where my partner picks up his appetite, he's ultimately having dinner at home. You know, so there are both sides to the coin or to the argument, but suffice to say that first you must focus on your pleasure, and next you must focus on the pleasure of your partner. Common sense dictates that you would try not to do things which take away your pleasure or your partner's pleasure or bring about hurt in your partner. So this was from a philosophical perspective or from a psychological perspective. And then we come down to the nitty-gritty of the sexual response cycle and how can we fix the sexual response cycle. So one step which you and I have been continuing with thus far is communication, yes, counseling, connect, sharing, reach out. So there is, you cannot but emphasize more on that facet of the relationship or of the situation to try and fix the situation. So
yes,
undeniably that is supreme. But as a doctor, without getting too technical, obviously, if there are medical issues, so there is a medical evaluation, just as if there is a disease or a condition, it needs to be fixed. But what you as an audience or you as a participant in that sexual act need to understand, that the man who won a gold medal in the Olympics did not win it by waking up one fine morning and then, you know, performing on the field and track and get a gold medal. You have to work towards it. So working towards it involves first working on yourself. So working on your fitness, working on your health, avoiding addictions primarily for yourself, and of course for the happiness of your partner, for your family, so that you're able to earn a livelihood, support people, be their security, and not be somebody who is so reckless that he couldn't care less about dying or living and what happens to his partner or his family thereafter. So being responsible first to yourself and then to your partner is a very important part of any kind of relationship, and needless to say, of good sexual performance. So as a doctor, we would red flag the medical conditions, we would counsel the person concerned to address those medical conditions. Unfortunately, despite everything, aging is a reality, and that change comes with its share of problems which negatively impact sexual performance and sexual activity, in which case we also need to reset goals for both partners so that they can continue to enjoy intimacy, whether intimacy means an orgasm or no orgasm. We as doctors do have drugs which I would share as information, not as prescription on this show, for both men and for women, which health matters. But before I talk about drugs, I must say the drugs are not step one of treatment. If you are on drugs, it is not going to bring about a brilliant sexual act without the other trappings of arousal, planning, anticipation, desire, and a connect between you and your partner. So if you have all of those things, you probably don't need the drugs. But yes, drugs can be a wonderful hand holder to help you perform better and thereby ease your anxiety and thereby fix all the other related events like intoxication and addiction, and you performing better as an employee, as a colleague, as a responsible citizen in the society. So if you have any additional thoughts, Sujata, on the psychological and the psychosocial aspects? I would be, I'd happy to hear from you. Otherwise, when we talk specifics, I can get down to addressing and fixing specifics in the man and the woman to help them have a better sexual act performance and whatever comes thereof.
Yes, doctor. Before that, I would like to ask a question that is it's a question by Ms. Vandana Hiranandani, that she's an experiential counselor and family therapist of families of addicts. And she has received a lot of questions from women asking about low sexual desire in women. If you could throw some light on that aspect, because women also are, find it very difficult to share about their own sexual desires and sexuality. And when they experience low sexual desires, they are often in a quandary as to what to do about it. So could you elaborate on why it happens and what can be the right solutions for the same?
So, I am a member of the Urological Society of India, and if I recollect correctly, about 2 decades ago, our society, which had thus far been mostly focused on men's sexual health, decided to run a program to focus on female sexual health. And you would be surprised from the learnings that I had from that exercise, where on a given day in my outpatient department, which would have a mix of sexual issue related patients as well as urological, stone disease, prostate and other patients, post this initiative and advertising and marketing, on a given day 80% of my OPD was to do with couples who or individuals who wanted to talk about sexual health, and surprisingly 50% of those were women. And needless to say that sex is not a preserve of the rich or the poor. There were some significant number of women who were from the underprivileged sections of society but had chosen to pay my consultation out of a corporate hospital, but they felt that that was really very important for them because they could not go to the movies, they could not have candlelight dinners. So it was very vital for them to have good sex. And whether it was their partner who was underperforming because of alcohol or it was something happening in their own body, but they wanted a solution. So I was so happy to see that women standing up for what they feel is their right. Now, usually, when do we lose heart? In a situation, we lose heart when we don't get our way. So, if I am confident, if I'm ambitious, if I'm driven about reaching my objective, I do what it takes to get there. But if for some reason my partner is discouraging me, if society seems to be against me, if my own family is not supporting me, then somewhere, instead of fulfilling my needs, I just accept whatever is my fate. So before a woman says that she is feeling low sexual desire, she should not hesitate to ask herself, am I feeling good about my life in general? Before I merely say sexual desire. So if the answer she gets is that there are a lot of things which I need to fix in my life, whether it is get economic independence, get some social liberties, get the freedom to speak her mind, whatever she perceives, if those are important things, she should demand them. The minute she starts getting what she wants on all those other counts from her partner, automatically her feelings and inclination towards her partner would change. By default, her so-called desire, the desire, when we talk of a partner, it's not only about the desire to have sex with a partner, it's about the desire to share my life with the partner, to share my highs, to share my day, to share my grievances during the course of the day. So if I have a partner who I always go to with all my troubles, by default, I am already hooked on to that partner. Now, if I am in a sexual relationship with that partner, commonsensically, my desire would also be there to have sex with that partner. So, that much for the psychological and social aspects of desire. There are medical aspects to desire. Needless to say, when your hormones in your teenage years are rushing, you are obviously having a good sexual desire, unless that comes with an unpleasant experience, like you talked of child abuse or some such thing happening within the family, which casts a negative shadow on that desire or on that act. But hopefully we are not dealing with that situation in this conversation, but we are talking of a situation where a woman has uh, had a relationship, has had her children, and somewhere along the journey, she starts feeling that she's having low desire. Now, low desire is also a part of low self esteem. So, self esteem or confidence comes from so many factors and not just our performance in bed. So, as much as we need to focus on our body image, if we feel that something is right or wrong, we need to address that, as against merely say that my partner has to come and fix my problem or a tablet has to come and fix my problem. We need to start feeling energetic. We need to exercise. We need to do whatever it takes to feel good. We need to address hygiene issues, because desire and hygiene are very intimately linked. If your partner is maintaining poor hygiene, that can affect your desire. So, having said all that, bodily changes that occur in women generally start happening after the age of 40, where the vaginal dryness becomes a major issue. It can be an issue earlier also, but that would be situational. If a person is having a vaginal infection or a urinary infection, or is undergoing a psychological trauma or depression, those are different situations, or those are more easily fixable. But when a woman is crossing 40 and finding that she is not generating adequate lubrication, the sexual act is becoming unpleasant, well, hormones have been used, though we do not regularly recommend them as sexual therapy, because they do come with some negative effects also. But low dose of androgens, which are the male hormones, as well as low dose of estrogens, which are the female hormones, taken orally may have more problems. So we recommend them to be used topically, intravaginally. So creams can be used, which, if I were to simply say, would be equivalent to saying that in winters you moisturize your skin to keep it healthy, so and supple. Similarly, the topical hormonal preparations make the vaginal lining healthier, and by default the secretions and others get normalized. There are some drugs which have been talked of in women, akin to what you would or we would talk about in men in the next few minutes, if time permits. But there are some drugs which a woman can take as a single shot injection, 45 minutes to an hour, which brings about a little improved desire, or take a tablet for 4 to 8 weeks, which has some beneficial effects. But in women, the medicines don't have as dramatic an action or an event which can be judged. So it is better if we first resort to all the other measures that I had talked of before we jump into an injection or a tablet to increase sexual desire. I hope I've covered most of what needs to be shared on this count.
Yes, doctor, you have beautifully put it across. Doctor, just as we have spoken about women so elaborately, men should not be left far behind. There are a lot of issues where men who have been used to consuming different substances have faced, like experiences of premature ejaculation or experiences of erectile dysfunctions which happen not necessarily just with the use of substances, but even otherwise. So, could you please provide the right solutions, what they should take up or what they should opt for in such situations, doctor, from your own experience?
So, first and foremost, people like you do a great service by bringing a person who's on the brink of a situation in his life and is then addicted to a substance where things are not going right. So, primarily, you bring them around, get them sane enough to then address issues of sexual performance. I again can't help first using a corollary of gold medal in the Olympics. Obviously, this gentleman who's just come out from his negatives of over consuming certain type of things, he is not overnight going to get a gold medal. So if he falls back into thinking, and this is thinking, this is not reality, that when his sensibilities were actually numbed by alcohol or an intoxicant, he was actually happier, that is hugely erroneous. The perception, you cannot perceive a thing better than through touch when you are sober. If you are not sober, what you are feeling is not actually what you're feeling, but you are thinking that something is brilliant. But actually, you are making yourself numb, you are becoming indifferent to your partner's requirements and are only being selfish to focus on yourself, and that too by blurring reality. Now, if this message seeps through, that's when the urologist, andrologist, and the male patient build upon performing better. Now, as I said, it is very easy for me to write a prescription in 30 seconds. We are all familiar with drugs like Viagra, and its clones, but they are all effectively working in the same way by increasing the level of certain chemicals at the level of the penis, increasing blood flow into the organ. So those drugs, if you take them, sildenafil, Viagra, as the people may know, they will not bring about an erection. The erection would still require desire, arousal before you reach the stage of orgasm. So being sober, taking the medicine, working on all the other facets of the sexual act, whether it is good hygiene, whether it is anticipation, whether it is fantasy sharing, whether it is role playing, all those come in, and that's when the drug that you may have taken would have its best effect. So long as there is any anxiety in the man's head at the time of indulging in that sexual activity, anxiety releases a hormone which we are familiar with called adrenaline. Adrenaline constricts the vessels, thereby blunting the blood flow into the penis. So no amount of performance enhancing substances would deliver if there is anxiety around the act, and which is where a counselor, a psychiatrist, a urologist all need to come in to address that anxiety. Now, oftentimes a man would tell me, doctor, if I could have an erection and I could penetrate, I would have no anxiety. So instead of telling me a lot of these things, why don't you just do something that I can penetrate my partner? Now, if we are talking a guarantee to penetration, then a guaranteed operation which gives a man an erection, or stiffness is a better word, is a penile implant. As a surgeon, we fix either a semi-rigid implant or an inflatable implant. We operate, and in the penile cylinders, the implant is fitted. If it is a semi-rigid, then the man is having an erection at all times, or a stiff penis at all times. He can penetrate and have sex any time of day. Or if it is an inflatable, there is a valve which is in addition implanted in the scrotum. So pumping on that valve pushes saline into the inflatable cylinders which are lying within the penile cylinders, cavernosa, and a more natural looking erection comes about. Once penetration happens, arousal is an ongoing feature, orgasm follows or ejaculation follows. Post the ejaculation, the man can again press the valve and deflate that implant. So guarantee is a penile implant for a man, leading up to then getting to need an implant. All of what we have shared thus far is to avoid that implant. However, I've been working in this field for a while and have been looking at various other options short of surgery in the form of wearable devices which could help a man achieve penetration. So some of those devices have very promising results. But like I shared, whether we are talking drugs, whether we are talking a wearable device, whether we are talking a surgical implant, we need to have a very clear understanding on the expectation setting of the person and expectation setting for the partner. So I think as much as you and I have tried to simplify this topic, it may have come across as rather complex. It's not necessarily complex, but it is not simple either. It is fairly exhaustive. Let's put it that way.
You're right, Dr. Sood. Thank you very much for providing the right solutions to both males and females and elaborating so much on this particular topic. Like what we come across or what we take away is that communication is the key. Seeking counseling and help at the right time is another key, and approaching the right physician for the right solutions, getting correctly diagnosed, and which will help in dispelling a lot of myths in the bargain is another key. Now, doctor, I would like to address some of the audience questions, wherein one question has been asked by Dr. Menon, Dr. Shashi Menon, who has who has spoken about, who has appreciated that it's a great session, but he would like you to address the difference between sexual performance and sexual function, as in his practice, he has found that the performance is more common and is a psychological issue.
So again, a wonderful question, and obviously it needed an expert with his share of experiences to ask me this question. Yes. I would try and separate out function from performance. So if we then get into slightly medical and legal side of the discussion, in relationships, in marriages, oftentimes a man or a woman's family brings a man saying that he is impotent. So now impotency, if that means functioning erection, well, a person would have erections in sleep, but whether he can perform when the need arises. So sexual function and sexual performance are definitely intricately linked but different. And a particular person may have a normal sexual function but may not be able to perform with a particular partner. So his sexual performance in a given situation is adverse. Now that's where sexuality comes in, wherein the person concerned has his preference for a different gender or a different kind of sexual act or intimacy. So the performance is compromised. Performance, of course, can be compromised by so many other factors, but very rightly brought out that having normal sexual function does not guarantee normal sexual performance.
Yes, thank you, doctor, for answering that so beautifully. Now, from Mr. Mahesh Hiranandani, a question which you kind of elaborated with in a very technical manner, but if you could put it across very simply, the question asked is that if you could define the term urge increases but performance reduces post alcohol and drugs in excess. This is a very common question we come across in the minds of our clients also, and it would be great if an expert like you would elaborate on it.
So while I know Mahesh personally, I'm going to take the liberty of explaining things to him and by default to the audience a little differently. So Mahesh, when we have a sore throat, what happens? There is a heightened sensation in the throat. There may be pain in the throat. But when we are having a sore throat, we don't necessarily sing better. So we first need to fix the sore throat to be able to sing better. Now, if we translate it into an urge in the genital area, which if I want to call it a sensation which is too intense is unpleasant and painful, but a sensation which is not very intense may be ticklish, pleasurable, or what you are talking of as an urge. Urge as a sensation is brought about by increased blood flow to an organ. It is brought about by the glands in that area becoming laden with more blood and causing more secretions to pour out. Now, here I want to separate two things. Trying to bring about that urge by taking a drug or a substance like the Spanish fly extract at one time was popular, whereby people consuming it led to a heightened urge. Whether it led to a better performance or a more wholesome sexual act, the answer is no. So instead of resorting to alcohol or the Spanish fly extract to generate an urge in the loins, it is better to play with your own mind and let the neurological events that follow deliver the same outcome or the same urge without compromising anything else. Have I answered it, Mahesh, to your satisfaction?
I think you have, Dr. Sood. There's another question.
The the clock is
Yes,
ticking, Sujata, and so as much as I could probably
yes,
carry on talking till tomorrow morning
yes,
breakfast time, but
yes,
I let
yes.
you decide how much you can accommodate
We
thereafter.
have we have another 2 minutes. So one last question.
All
Smoking
right.
is a very common habit in most people. So Mr. Pavan Kumar
Yes.
has a question that smoking affects sexual performance, or how can quitting or cutting down smoking or minimize the adverse effects on sexual health?
Okay. So I'll try to explain it to him like this, that I get up from sleep and I now need to suddenly run 100 meters without any kind of warming up. So normally a coach would tell an athlete, please warm up. What is warming up? So he starts exercising, stretching before actual peak performance. During this warming up phase, the heart rate is increasing, the blood pressure is increasing, the respiration is increasing. So the body is transitioning from sleep mode to peak performance through a wakefulness process. Now, smoking is a stimulant, just as maybe cocaine is also a stimulant. So smoking while you are sitting in bed has actually increased your heart rate and your blood pressure. So somewhere it has energized you a little without you actually indulging in anything energetic. So, and of course it has central effects on the brain also, but so it brings about a feeling that wow, I can, I'm ready to perform. But smoking has a lot of side effects. Even one cigarette can cause spasm and a heart attack. Multiple cigarettes cause contraction of the vessels, cause atherosclerosis, cause hypertension, can lead on to strokes and heart attacks. So smoking in the long term for sexual performance, in no way is it good. Even in the short term, in terms of blood flow to the penis, it is not good because it is constricting your vessels. It's a different matter that the person may be 20-year-old and smoking, whatever it is compromising in terms of blood flow, the erection is still happening because those blood the pipes or the arteries are still supple and open. So despite whatever negative nicotine is doing, the man is getting an erection. But what positive nicotine was doing to the brain and the body made him feel that it is improving his sexual performance. But it is not improving sexual performance, but it is altering his perception to an extent.
Thank you, Dr. Sood. I think that answers the highlighted question in the mind of all smokers out there who are watching us right now. And with that, I would like to conclude our session. Doctor, thank you for this wonderful, fantastic, enlightening session on a topic which is very least discussed, very oft, very less discussed, on addiction and sexual dysfunctions. I am sure our audience has been benefited greatly, and thank you to our viewers for being so interactive and asking so many questions in the process. Thank you, Dr. Sood. Thank you for your time, and it was a pleasure conversing with you.
Thank you for the opportunity, and it was indeed a delight interacting with you and the audiences, and I look forward to many more such interactions. Thank you very much.
Definitely. Thank you.